Hey everybody, Colonel Pringle here with an update on our coronavirus response efforts. As many of you know, the City of Grand Forks and Grand Forks County recently declared a public health emergency in response to coronavirus and COVID-19. Today, Grand Forks Air Force Base is following suit. In addition to our declaration of a public health emergency, I have directed that we elevate our health protection condition to HPCon Bravo. Together, these steps will allow us to react more quickly to a potential outbreak, as well as preparing in order to potentially slow the spread of the disease. Let me be clear, at this time, there are no positive confirmed cases of coronavirus or COVID-19 at Grand Forks Air Force Base or in Grand Forks County that we know of. We know the disease is in North Dakota and spreading across the country, and we expect its eventual spread into our community. That's why we're acting now, to slow the spread. It's important to note that we have some members on base who are restricting their movements as a precaution based on symptoms or recent travel. If we become aware of a coronavirus case on the base, we will definitely let you know. The fight against coronavirus is going to be a long one. Each day without an infection is a win in this fight. One of our best weapons in the fight against coronavirus will be information. For that reason, I've asked our public health officer, Captain Clay Whidden, to be here to answer a couple of questions in particular. Captain Whidden, would you explain, please, how healthy people can act and should act in order to prevent the spread of coronavirus, and what someone should do if they think they might be infected?
Yes, sir. So if you're healthy, what you can do is practice all the hygiene practices that we've communicated every flu season and communicated more during the coronavirus. So what you can do is hand wash frequently, disinfect your workstations, practice social distancing so that you're not posing yourself to unnecessary risk. So trying to stay out of the community, trying to stay out of common areas, but stay in your homes, hand wash frequently, disinfect your house frequently, and then if you are feeling ill or you're concerned about the coronavirus, please call the MTF appointment line, which is 701-747-5601.
Thanks, Captain Whidden.
Yes, sir.
Chief, would you mind sharing some thoughts, please?
Of course, sir. So teammates, good morning. Going to cover a few topics in the realm of taking care of airmen. First and foremost, I want to thank everyone for all the efforts that they're doing, that are ongoing. Hey, we are good at taking care of each other. This is something that we do all the time, and this virus should not impede that. Continue doing all the great things that you are to connect with your friends, your family, and your airmen, and keep getting after that. We are definitely proud of everything that you're doing to take care of each other and our community. A couple things in that realm. We have a lot of our teammates that are hunkered down at home, staying away from their work centers. This doesn't mean that you're socially disconnected or isolated. Continue communicating with each other via whichever means that works best for you. Text, social media, and as Captain Whidden said, practicing good social distancing, you can still have some face-to-face conversations. Reach out to your teammates early and often. Communicate with your families, your friends, let them know how you're doing. We just heard yesterday that we're going to continue to receive our incoming airmen from tech school. Between now and June, we approximately have about 54 incoming airmen. As you can imagine, if you think back to going to your first base, that's a pretty stressful time. And sponsorship is essential. Welcoming our airmen into our community is extremely important. If you're a sponsor, whether you're at work right now or at home, I'd ask you to reach out to these folks early and often. Try to make their transition as smooth as possible. As you understand, this is a stressful time, and if you kind of put yourself in their shoes, you can imagine all the different questions that they have. Some of these folks might have been planning a trip home in between their PCS, and that may not happen. We need to make contact with those folks, figure out what their plans are, and make sure that we bring them into our base correctly and support them. Also, I'd like to cover our deployed members. Please do not forget about our deployed members and their families. As you know, During the normal conditions, information exchange can be difficult at times. And right now, during this period, it's vital that we reach out to them, make sure that they have all the information that they need to understand what's happening here locally, and make sure their families are equipped with all the information that they need that they might not be getting if they don't follow us via social media channels. So please, reach out to your deployed teammates and their families and check on them. Now, the last thing I'm going to cover is your questions. We're doing our best to keep up with them. They're coming in fast and furious. Literally, information is changing by the hour. Your leadership teams are doing a fantastic job with bringing us questions. We're nugging through those and we're trying to address them as we can. Please be patient with us. As I said, things are constantly changing. Your leadership team is doing a fantastic job of making great decisions at their level. We're going to continue to support that. They're empowered to make those decisions. If you have questions, bring them up to them. Keep them coming. And again, we'll do the best that we can to address those things.
Thanks, Chief.
Yes, sir.
Thanks for your leadership, and thanks, Captain Whitten, for those words. Really appreciate it. In addition to the public health team, a lot of members across this space have been working incredibly hard to keep us informed and to keep us safe during this event. So here are a couple of thoughts on how we think this is going to look going forward. First of all, we fully expect the coronavirus to eventually spread to our community. We'd love to hope to prevent its spread, and we're going to act to do that if we can, but our goal really should be to flatten the curve. Every infection that we can delay will minimize a potential sudden spike in cases, and that makes whatever response is required easier and will limit the impacts of the disease. This is going to be a long fight. We need to take action now and reassess what's sustainable to continue the fight for the weeks and months ahead. And that's why we've gone to a mission essential status here on the base. I know it's caused a lot of confusion since we've implemented this status because we've done it differently than how we normally implement mission essential status for a severe weather event. But we have to remain flexible in the fight against coronavirus. And squadron commanders will set the pace and determine those actions which are essential for the accomplishment of the mission within their units. For example, the 319th Medical Group here has implemented some really innovative procedures for screening that will both protect our warrior medics and ensure that they can continue to provide the services that we need. So going forward, you'll see changes in services across the base and across the community. Rest assured that your wing leadership is working closely with local authorities to keep you informed and to do what we can to prevent the spread of this disease. The warriors of the North and the members of our wing across the world are doing a great job of responding to this scenario. We're rolling out all the tools we can mobilize in order to make the mission happen under challenging conditions. Above all, though, we need to take care of each other. Today, each of us plays a role in each other's safety. You need to know that the safety of our airmen and our families is absolutely our top priority. So let's get out there and fight this fight together. Thanks.